Assalamu alaikum, everyone. May peace be upon you. This is Edward Ahmed Mitchell, welcoming you to today's segment on Muslim Network TV. Thank you so much for joining us. As always, we begin with a prayer in the name of God, the most compassionate, the most merciful. All praise and thanks belong to God, the Lord of the worlds. May peace and blessings be upon all of God's prophets and messengers, including the prophet Muhammad. May peace be upon him. Today, we're going to be discussing something that impacts literally every single person in the world, and that is the environment. Many of you heard of the horrific wildfires that broke out in Canada, smoke from which then spread down to the United States, causing all sorts of difficulties here in our country. This is just one example of some of the environmental problems that we are facing around the world. To discuss the cause of this, what can be done about it, what it all means, I'd like to bring on our special guest, Dr. Samantha Green, who is a family physician at St. Michael's Hospital and an assistant professor at the University of Toronto. She is a lifelong environmentalist, and she formerly served in the board of directors of the Sierra Club of Canada. She's also a member and former chair of the Health Providers Against Poverty, and she teaches about advocacy and social determinants related to health. She's also the new president of the Canadian Association of Physicians, and we're very happy to have her here. Thank you so much, Dr. Green. How are you doing?
Good. Thank you for having me.
Absolutely, absolutely. So first, tell us a bit about what happened a few weeks ago. These wildfires in Canada that broke out, spread to the United States. What caused that? Was this a man-made creation, someone setting fires, accident? Is it something with the environment? Tell us a bit about that.
Sure. I mean, this is the worst wildfire season that we've really ever seen in Canada and certainly in Quebec. A lot of the fires were sparked by lightning storms and then got out of control because of dry conditions and unseasonable heat. And it's all attributable to the climate crisis. As you all may be aware, we are currently at about 1.2 degrees of warming above pre-industrial levels. And that is driven by combustion of fossil fuels globally. And we're on track to continue to warm over the coming decades. In fact, we are currently on track to hit 1.5 degrees over the next couple of years, and then potentially 3 or over 3 degrees by the end of the century.
So, Dr. Green, what does that mean? I mean, if those wildfires cause that amount of difficulty in Canada and America, I can only imagine what warmer weather would mean. But tell us what some of the consequences are of this increase in the temperature around the globe. And also, the strange thing about the wildfires was I can't think of a time where that amount of smoke spread to another part of a continent and was so thick that it created an air hazard. Is that unusual? Has that ever happened before? What's the consequence of that kind of sudden onset of bad air quality? And what are the consequences of an increase in temperature in general?
Right. So, I mean, the climate crisis is here, and it's a health crisis. And we've seen that, and it was quite dramatic over the last few weeks when we looked out our windows and saw orange air outside. When we're exposed to wildfire smoke, there can be direct consequences on our health. Older people, young infants, and people with underlying health conditions are most at risk. So people who already have pre-existing lung or heart disease, but we're actually all at risk of harm from particulate matter, PM2.5, the really tiny, fine particulate matter that's embedded in wildfire smoke. There's emerging evidence because we are seeing an increase in wildfires globally in Australia, in Canada, in the United States. And so there is emerging evidence of both short-term and long-term impacts on health, including an increased risk of cancer in the longer term. In the shorter term, the exposure to wildfire smoke can trigger heart attacks, can trigger asthma exacerbations, can cause headaches, can cause adverse pregnancy outcomes, so low birth weight in pregnant women. And this is only one health consequence of the climate crisis. We're also seeing an increase in extreme heat events and heat exhaustion and heat stroke that can happen during extreme heat events, as well as worsening of other chronic conditions that people may have. We also see a change in infectious diseases. So, we see Lyme disease across Canada now, which we never did before. There's an increase in malaria in the United States. We also see an increase in extreme weather events such as hurricanes, flooding. We see an increase in droughts worldwide, which leads to food insecurity. And we're seeing, indirect health consequences as well. So migration, one cause of the Syrian refugee crisis of a number of years ago was actually drought and exacerbated famine, which contributed to conflict in Syria. And we're seeing that also in Central America. And the migration crisis in Central America is largely driven, again, by drought and repeated hurricanes hitting that region of the world. So we know what we have to do to solve this problem, which is to stop burning fossil fuels. And we need to do that immediately and urgently in order to solve this climate health crisis.
So, Dr. Reed, next question for you. You mentioned that there's an increased risk of disease, malaria, Lyme disease. Tell us more about that. Why is the climate crisis contributing to a potential increase in the spread of disease?
Right. So with warming weather, we see longer summer months, and we also see areas of mosquitoes and ticks increasing. So the regions where the deer ticks that spread Lyme disease, the areas where they can survive is growing. So now we can see Lyme disease like in central parts of Canada where those ticks couldn't survive before. And similarly, the particular mosquitoes that spread malaria and dengue, the regions where they're able to survive are growing. And so we will see, and we are seeing already, an increase in those infectious diseases. And likewise, likely climate change is a driver of future pandemics, unfortunately, because as the climate changes and the landscape changes, we will see an increased proximity between humans and animal vectors of disease. So likely climate change will be a driver of future pandemics.
So next question for you then, Dr. Reen, which is the following. What are some short-term solutions? Obviously, I know you mentioned that conviction that the ending of burning of fossil fuels is key. Obviously, most governments and countries are not willing to do that right now. And so is there something short of that governments can be doing, should be doing to at least stop the bleeding, so to speak? And also, what's the status of the Paris Climate Accords? Well, I know the United States pulled out of that under President Trump. I think we're back in it now. Are countries meeting their obligations under the Paris Climate Accords? And is there anything else countries can be doing in the short term to try to stop the bleeding?
Right. I mean, we must, it's very clear from international reports. The International Energy Agency, which is made up of experts globally. Also, the Intergovernmental Panel on Climate Change, the IPCC, which is an international group of experts, all countries represented. They have both said, we must stop burning fossil fuels. No more fossil fuel infrastructure, period, end of story as of today. No more pipelines, no more gas plants, no more coal-fired power plants. And so we must urgently make that transition. Governments may seem unwilling today, but we actually just need to push them to do it, because there is no way that we will survive as a species. This is an existential crisis. We must do this, and we must do it urgently. And so there's no halfway. Right? We just have to do it. And you know what? The good news is that we will see immediate health benefits and immediate benefits to our society if we make this transition. Because right now, coal-fired power plants actually cause tremendous health harms directly through air pollution. So if we make this switch to renewable energy, then we will actually see an immediate health benefit from decreased air pollution, and we'll see the long-term health benefit from tackling the climate crisis. I'll just add that another thing that we do need to see all levels of government do is implement policies that help us adapt, because we are seeing these increased wildfires today. We are seeing an increase in extreme heat, and we will continue to see this get worse. This is not the new normal. Actually, we are continuing to warm over the coming decades. So we'll actually see worsening of these impacts. And that means we need more solutions and adaptation. Perhaps we need an investment in firefighting. We need an investment in cooling, and policies that protect the most vulnerable so that they have access to cool indoor spaces. We need an investment in clean air so that people who are most vulnerable can go to places that have clean indoor air during times of crisis. So we need both of those things. We need to very rapidly adapt, and we need to very rapidly stop burning fossil fuels.
The last question for you, Dr. Green, which is you're the incoming president of this new organization. What's that organization dedicated to? And tell us a bit more about their work.
Yeah, so we're not a new organization. We've actually been around for 30 years. This is our anniversary. But we are dedicated to protecting the health of people by protecting the health of the planet. And we're doing that across the country here in Canada by advocating for strong climate policies, both solving the climate crisis, stop burning fossil fuels, and that adaptation angle. We are, for example, advocating here in Canada for a ban on fossil fuel advertisements, because just like tobacco, fossil fuels kill people. And so we no longer allow cigarette advertisements, and we should not be allowing the advertisements of fossil fuel or combustion driven vehicles either. And so that's one of our campaigns. We're also campaigning around the protection of people from toxic substances. So not just around climate change, other environmental hazards in order to protect people's health.
So, Dr. Green, with all these health dangers, the air quality and other things that are popping up sometimes suddenly, what are some of the things that individuals can do to protect themselves from these difficulties in the environment, whether it's toxic substances or problems in the air, stuff in their food? What are some of the things that you would advise people to do to protect themselves?
Right. So I think that two major threats in many parts of the United States are extreme heat and exposure to wildfire smoke. So I think it's important that each of us makes a plan for what to do when one of these events happens, and what we can do to help our family and neighbors as well, because there are people in our lives who are probably more vulnerable. So the elderly, people who are isolated and live alone, especially people without access to air conditioning may be more at risk, and we should make a plan. And then, when there is poor air quality, so it's important to monitor air quality and watch out for poor air quality. It's usually reported as the air quality index along with the weather. So if there is poor air quality in your city, then stay inside, keep the windows closed. If you're going outside, it can be helpful to wear an N95 mask. And that can protect you from some of the particulate matter, though not all of the air pollution. But yeah, I think it's important to have a plan. And around extreme heat, if you do not have air conditioning, then it's important to have a plan for where you can go that's cool, whether that's, your mosque or a friend's house, or maybe your city has a publicly available cooling center. But it is important to have a plan and to activate that plan when there is an extreme heat event.
Well, Dr. Green, I want to thank you so much for joining us today to share your perspective on these issues that everyone's concerned about, has different views about, but everyone is talking about it because it's something that impacts all of us one way or another, either economically, environmentally, socially. And so I want to thank you for your time and your contributions, and we look forward to having you back in the future to discuss this further, God willing.
That would be great. Thank you.
Thank you. And thank you all for watching. We appreciate it, and we will see you next time on Muslim Network TV. Until then, inshallah, assalamu alaikum. May peace be upon you.